A prison is a place of confinement, or specifically an institution for confinement of persons convicted of serious crimes, compared to a jail, where those confined are awaiting trial or sentencing. Dating back to a 1986 report, prison cells continue to have an average of 34 square feet per inmate in a two-person cell, compared to inmates in single cells having an average of 68 square feet. The minimum amount of space now in prisons, jails, and even juvenile detention centers range from 63 to 80 square feet, which is smaller than the average one-car garage. The CDC advises social distancing of 6 feet, which is 2 arms length. Yet, a sneeze can travel up to 27 feet. Samples from medical providers out of an ICU in China indicate that shoes can also carry the virus. Therefore, if one inmate has the virus, it can spread to their roommate and can continue to spread in public spaces, including the lunchroom, the courtyard, workspaces, education spaces, and with prison overcrowding, it is likely that the virus could spread in mass numbers. Even guards can be transmitters of the virus. As of April 12, 2020, the Federal Bureau of Prisons has 352 federal inmates and 189 staff members that have tested positive for the virus. However, this does not cover the number of those that may have tested positive for the virus in state prisons. It also does not cover those that enter and exit county jails and that are admitted to these jails every week. Though more than 3,942 people have been released from county jails in Colorado, California, Utah, Hawaii, Michigan, Virginia, Pennsylvania, New York City, New Jersey, Arizona, Ohio, and Washington State, prisons have been much slower to release prisoners. Reports show that more than 40% of state and federal prisoners and jail inmates reported having a current chronic medical condition, while about half reported ever having a chronic medical condition. Prisoners still have to pay for medical care, sick calls to nurses, copies of their medical records, and their prescriptions. And though they are offered a $2 to $5 copay, most are being paid 14 to 63 cents an hour. So if a prisoner is making $100.80 a month and has to call the nurse, schedule a visit, and has to pay for their prescriptions all in the same month, while a percentage of their income is taken out to pay for criminal justice fees and pay to stay fees, which are housing fees, on top of the list of items such as stamps, shirts, personal hygiene items, religious equipment and items, medicine, vitamins, soap, pens, notebooks, and even greeting cards, which can range from 90 cents to $1.30 per card. 10 states in DC do not charge copays, and 11 states have suspended all copays with the uprising of the virus. Another population that is highly affected by the virus are older adults and elderly prisoners. Older adults and elderly prisoners have been increasing in prisons due to war and drug policies. And by 2030, an established 1 in 3 people in federal and state prisons will be aged 55 and older, more than triple the proportion in the early 1990s. Prison policy is pushing for 5 key implementations, which I call reduce, reschedule, and rethink. 1, reduce the number of people in local prisons. Police can reduce the number of arrests, and courts can vacate bench warrants, which are warrants that are unpaid court fines and fees, and for failure to appear to hearings. 2, they can reduce the number of people in state and federal prisons. People nearing the end of their sentence, or people who are on work release or are medically fragile should be released. 3, eliminate unnecessary face-to-face contact for justice-involved people. 4, make correctional healthcare humane. Eliminate medical copays. And 5, don't make this time more stressful for families. A form of compassionate release is available in all states, and we should be pushing for this.